Hello, everyone. It's Tuesday, July the 20th. I want you to remember this day. It's Tuesday, again, July the 20th. And just think for just a second and remember July 20th. This is the day that over the weekend we do not have one single death that I've got to report. You know, we've come a long ways, a long, long ways. We're still not out of the woods, we know that. We've lost 2,919 folks in West Virginia. We still have, you know, a little over 100 active cases, and we still got a bunch of folks in the ICU units and in the hospitals. But we have come a long way, West Virginia, and we have been the miracle to our nation. A state that abounds with the third most elderly, lots and lots and lots of chronic illnesses, was labeled the most vulnerable of all the states, and yet you've led the way. You've led the way over and over. You have a lot to really be proud of. Now, we don't want to drop our guard, and we want to continue to get more and more and more folks vaccinated. But today is the first day. The first day in forever and ever that we have been able to report to you that there has not been a single death reported in West Virginia since we were together last Friday. So it is what we hope and pray is going to become the new normal. We absolutely know this Delta variant is out there, and it could cause us more and more and more potential problems. But we know that absolutely we have got, you know, vaccinated right at 90% of our 65-year-olds and over 80% and heading toward 85% of our 50 and olders. And so we know this disease, we labeled it right off the get-go as we jumped out ahead of everybody on the vaccines and the vaccination rate. We did it because we identified that this disease attacked the elderly. And while if you'll go back to January and think, you know, if you were 65 years of age and older, especially if you may have been 80 and older, you know, at that time, you were basically told by our federal government that we wouldn't be able to get to the general public. Even with age, we wouldn't be able to get to the general public till sometime in April. And we moved. We changed that. And absolutely, we got thousands, tens of thousands, hundreds of thousands vaccinated, and we could have lost a bunch of those folks. And so I congratulate all the experts, the healthcare communities, all those first responders, everybody that stepped up. The Guard, gracious, what a job they did. And you know, and so today's a big day of celebration, a big day. And I could not possibly be any happier. So congratulations, West Virginia. Remember July the 20th. And let's hope and pray that this will be the norm as we go forward, or we'll get a lot more days like today, and then eventually we'll extinguish this killer that absolutely ran through all of us. Just to go through the numbers real quick, we have 82 positive cases in West Virginia in the last 24 hours. Our daily positivity rate's at 3.20. Our cumulative is at 4.95. Active cases are 1,098. Our recovered cases are 161,000 and change a little bit. And we have 85 folks hospitalized and 33 in the ICU units. We have no red or no orange counties, but we have 1 gold in Webster and 7 yellow counties. We remind people every time that we come on that if you're 65 and older and absolutely you get any type of unusual or anxiety or whatever it may be feeling, go get a test. The antibodies are sitting there waiting on you, and they'll take care of this, and you won't become a casualty. Vaccine eligibility, 12 and older. It's really important for you to get your second shot. You know, the vaccines are terrific. You know, absolutely, they do a great job on this Delta variant, and all the science tells us that. You know, our young people are the ones we still are trying to push. We're pushing the 65 and older and the 50 and older, but we're pushing our young people to go get vaccinated. All the information on our COVID-19 info line is up on our websites. I've told you lots of stuff about the variant, the Delta variant, and Dr. Marsh has chimed in as well in every way. We have now detected the Delta variant in 11 counties, and we have 22 cases in West Virginia. It is ever so slightly, creeping up, but right now, West Virginia, we don't have a big-time problem with the Delta variant today. Now, I just came back from Clay County, and we dedicated or made another step forward in our rail trails effort up there on Buffalo Creek and on Elk River up there, and all that is really, really coming together. You know, Clay County can already see a marginal difference in folks that are visiting that area and everything, and we want that to happen in a span that will make us the second largest continuous span east of the Mississippi River. You know, it's a beautiful, beautiful area. Speaker Hanshaw was with us, as well as the Clay County Business Development Authority. You know, their president, Mitch DeBoard, he was there. Brett Boggs, Delegate Boggs was with us, and there was a bunch of folks, you know, from the mayor of Clay, there was county commissioners there and everything, a bunch of folks, a big crowd of people and everything. Really, really proud of all the stuff that's going on. And really what this really is basically the restoration of the rail trail and everything from the standpoint of the flood that went through there that devastated that community in every way, like it did, all over across our state in 2016. So it's a big deal for the Elk River, a big deal for Buffalo Creek, a big deal for tourism in West Virginia. And everyone knows we made a real life commitment to tourism, and we continue to grow that. We salute Secretary Ruby and Chelsea, what a job she's done. And so let's just keep at it. You know, we had with us up there Steve McDaniel with our DNR, and you know, these folks are really just champions. They do great, great stuff. So a great day for that area. Now, I want to comment just a second on the big basketball tournaments going on in Charleston and everything. Good stuff. Those teams are playing for $1 million, and you know, we had two teams from West Virginia. The Marshall team lost last night. I think I just was told on a buzzer beater. I didn't get to see the game or whatever like that, and we congratulate them in every way. We had another team that's basically a West Virginia team and everything. They're called Best Virginia, and they won their game last night, and they are advancing on to the Sweet 16, and that game is at 9 p.m. tonight. So I would tell all West Virginians to get out and go to this. This is just another driver of an economic boost for the Charleston area, and what a job they're doing. Seth Greenberg is a great friend. Coach Greenberg had coached at Virginia Tech, and now one of the super analysts and everything, you know, is doing the games, and you know, he's just a great friend and a great man. What an incredible family. And Seth, we know, you know, I want to check you out on television. I hope to goodness you won't drop the ball too bad. No, I'm just teasing you. He is a great guy, great guy, and we thank him in every way. And that game, the WVU game, really is tomorrow night. I think I said tonight, but it's 9 o'clock tomorrow night. Anyway, go support this great event for the Charleston area and these great kids and everything. They're young men, but you know, what an effort they're making and everything. We're really, really proud of all of them. And I saw where Rondell played for me, and he had a dunk the other night right at the end of the game, and I think that won the game. And nevertheless, I'm so proud of all these young people, and so proud of Charleston for pulling this off. What a job they've done. I'm going to go real quick. Tomorrow is our Do It for Baby Dog sweepstakes. We'll be giving away, like I have said before, $1 million to somebody. We'll make another West Virginia a millionaire. We'll have 2 of our brand new, outfitted trucks that we'll be giving away, as well as 25, getaways at our parks, and 5 lifetime hunting, 5 lifetime fishing license, 5 custom rifles, and 5 custom shotguns, and really, and this probably is the biggest to me, 2 full 4-year scholarships to kids. This is a terrific thing, and any way we can support our children and everything is just good stuff, really good stuff. So anyway, we'll be doing that tomorrow. Forgive me, I don't know why I'm coughing, but but a vaccine update real quick is just this. Like I said before, we've got 88.8%, it's unbelievable, 88.8% of our folks that are 65 and older with their first dose, and 81.6% of our 50 and olders with 1 dose, and 67.2% of all the eligibles from 12 on up that have gotten their first dose. Just remind you to, all of our free testing, testing map is up there. Again, thanks to Walgreens and Frith for all that they've done. And I can't tell you enough, take advantage. Long-term care facilities, we're down to 2 outbreaks. We have 5 outbreaks in our church community in 4 counties. That's Cabell, Marion, McDowell, and Webster. We have 1 inmate that has COVID and 4 staff cases. And I encourage you every day, give blood. It is absolutely essential. And if you've had COVID and everything and survived and gotten well and everything, you ought to really seriously consider it. Thank you so much. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and certainly, as the governor said, it is really good news that we haven't lost any West Virginians over the last several days to COVID-19. But I think it's also important for us to recognize what's going on around the country and what's going on with the Delta variant. So around the country, we saw the highest number of new cases yesterday than we've seen in several months, which was 55,000 new cases. The average daily number of cases last week was over 32,000, and that is a doubling of what we saw 2 weeks before. And when we look at the number of hospitalizations, that's gone up 26% in the last week. Deaths have gone up 13% around the country. And what we're seeing, as we talked about before, is that most of the deaths and most of the hospitalizations, 97.5% of the hospitalizations, 99.5% of the deaths, are in people not fully vaccinated for the hospitalizations or unvaccinated for the deaths. So we see what an important role these vaccines are making. When we look at the amount of spread and growth of the Delta variant of COVID-19, on July 17th, we reported that 58% of the new cases in the country were from the Delta variant. Yesterday, we just found from the CDC's director, Dr. Walensky, that now 83% of the new cases of COVID-19 in the US are from the Delta variant. And as we track West Virginia's cases, we know that the Delta variant will take a stronger and stronger hold on us as well, because the Delta variant doesn't really understand state borders or even country borders. And so we know that as COVID spreads around the world and as people get infected who are not fully immunized, then the virus can mutate and cause infection. A really important study coming from China demonstrates that comparing 63 people with the Delta variant of COVID-19 versus 62 people, I believe, who had the original COVID-19, the one that started in Wuhan, that in their airway tracts, the Delta variant causes 1,000-fold increased amount of virus versus the original variant. And it, by their epidemiology, it starts to infect people in 4 days versus 6 days. So we know that asymptomatic spread is also a significant concern with the Delta variant, and the fact that there's so much more virus that appears to be located in the respiratory tracts, the airway tracts of people with the Delta variant suggests that that may be a critical reason why the Delta variant spreads so much more than it does from other forms of COVID-19. The American Academy of Pediatrics came out yesterday and augmented the guidance and their suggestions from the Centers for Disease Control and suggested that by their assessment, every child over 2 years old should be masked in schools. Now, CDC basically came out and said that they felt that if you are unvaccinated, certainly masking is reasonable along with other mitigation measures. But if you're fully vaccinated, you didn't really need a mask. And as we see from the data, the real world data around the world and the US, then being fully vaccinated in 2 weeks after gives you a significant protection from new infections, probably around 90%. The low that was reported was in Israel at 64% of fully vaccinated people with Pfizer. That has been a real low level in many other studies done. So probably about 90% for the mRNA vaccines protecting you from being reinfected to be a breakthrough case. And the Johnson & Johnson appears to be about 66% effective in keeping you from being reinfected as a breakthrough case. But all the vaccines, the Johnson & Johnson as well as the Pfizer, Moderna, are exceptionally good at protecting people from being hospitalized or admitted to the ICU or dying from COVID-19, probably a 95 to 99% range. So we know that this virus as it is today in the US and around the world, the Delta variant particularly, is a preventable viral infection. It is one, though, that in the unvaccinated is causing more and more severe problems, including children and young adults, which we're seeing in the hospitals around the country and in the ICUs around the country. The last thing I'll say is that Scott Gottlieb, who is the Food and Drug Administrative lead under Donald Trump, said that if you are not vaccinated for COVID-19, you will become infected with the Delta variant, and this will be the most severe viral infection you'll have ever faced in your life. And although those are very dramatic words, we're really, really concerned about the folks that are not vaccinated, number one, and also the folks that aren't fully vaccinated. So we really, really urge, encourage, beg, plead, whatever the right words are, with West Virginians who are not currently fully vaccinated or not vaccinated at all. Please choose vaccination. There's still time, but the Delta variant is coming, and certainly it is here and growing in West Virginia like it is the rest of the country. Thank you.
All right, thank you, Dr. Marsh. Secretary Bill Crouch from the DHHR is also joining us today and is available for questions. Retired Major General Jim Hoyer and Dr. Ainam Jad had prior engagements today, and they will rejoin us next time. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good afternoon, Governor. Good afternoon, cabinet members. Dr. Marsh, I'd like to circle back to you because you noted the dispute between, or difference, maybe not a dispute, but the sharp difference between what the American Academy of Pediatrics is recommending versus what the CDC is recommending. What would you recommend as a doctor that state public schools do? We have contacted numerous public school districts in the state, including Kanawha County, which is probably the largest, and they're in a quandary. They haven't made a decision on whether they're going to make masks mandatory or not, and they're looking for some guidance. So what would you recommend, and where are we at in terms of getting kids down to age 10 vaccinated? Is that going to happen before school starts or not, in your opinion, and should it?
Dr. Marsh, please.
Thank you, Governor, and thank you, Mark. Well, you know, if you really look carefully at the guidelines from the CDC and the American Academy of Pediatrics, they're actually not that different. CDC recommends that if people are fully vaccinated and 2 weeks out, that they aren't required or shouldn't be required to wear masks in the classroom. But they also said if you can't determine the vaccine status of all people in the classroom, or if you have people that have not been vaccinated and the prevalence of the virus is high, then it is reasonable to have everyone then wear masking. Also both suggested 3 feet of distance is optimal, increasing ventilation. CDC recommended the potential of testing once a week students who are not vaccinated and people in the classroom, teachers and staff, and also for athletes twice a week. So I think that there is a lot of consideration being done right now that is really focused on the risk of the new variant, the Delta variant, and the fact it seems to spread so much more rapidly. Again, it has a reproductive value of 5 to 8, which means one person infected is likely to infect 5 to 8 new people. And as we just are learning, there seems to be a real increased amount of virus in the respiratory tracts of people infected with the Delta variant, which would then presumably make the contagion, the droplets or the aerosol that are produced by those people, have much more virus in them, which may account for the more easy infectivity. So I think that as we go forward, certainly, you know, the governor and Superintendent Birch and Deputy Superintendent Blatt, along with the county school boards, will make that decision what is best for our students. But I think it is really important to note that this Delta variant that we're dealing with is a really different virus, very different than the viruses that we faced last school year, much more infectious and much more likely and able to infect young people, including children, and they in turn infect other people, including adults and other children, than we saw with the variants before. So appropriately taking those protection measures in the classroom will be important. And certainly, we'll all look to the leadership of the Department of Education, the county school boards, under the governor's direction to determine what's the safest approach for our students and folks in schools in the upcoming year.
All right, thank you, Mark Curtis. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel members and fellow journalists. I want to dig a little bit deeper into the numbers, and perhaps there is an adjustment that could be made on the dashboard to let us know how many people total unvaccinated are infected with COVID-19. I hit on this a little bit the other day. The fact that we've had highly publicized situations involving Texas lawmakers and other folks out there that have had some breakthrough cases, I think calls attention to it as well. Are you looking at a total number of the unvaccinated as a subset of the total population and saying, okay, these people are still getting infected at a high rate, and it won't be, and I'm trying to find the right nomenclature here, that you wouldn't get as high numbers as you would have, as we did in the spring because of the vaccine, but still among that unvaccinated population, we're going to have a real problem if they don't get with the program. Could you comment on that? Maybe Governor, Secretary Crouch, Dr. Marsh. Thank you.
Paul, let me make a run at it. You'll never know how much that I would love to sit here and say to you, we're safe now. We're completely safe, and I feel really good about it, and the health experts feel really good about it. We feel a whole lot better. There's no question we feel a lot better. But it would be great to be able to sit here and say to you, there's not really a whole lot of urgency now for you to go get vaccinated, but you don't want me to just blow smoke at you, and you don't want me to be a politician. We're in a situation in our state, really and truly, that it'd be so much easier to just say, well, if you don't want to be vaccinated, just don't be vaccinated. And really and truly, there's probably some of you that are going to get this and going to die, but really, I told you, so that doesn't matter either. It'd probably be easier to do that. It surely would be easier than draw criticism of people saying, well, it's my right, I don't want to get vaccinated, and it is your right. It is absolutely your right. And I'm going to respect that no matter what. That's all there is to it. But there is no question whatsoever that the more that we vaccinate, the less people will die. We know that for sure. And we absolutely just heard a really profound statement that Dr. Marsh just said to us, and I want you to be sure that you hear this again, because you can see right here, I make, as different people are speaking, I make notes of what they're saying and then try to summarize at the end. That's what I always do, because I'm always trying to learn more and more and more, everything I can possibly learn every day. Dr. Marsh, I think, just said a second ago, now just think about how profound this is. He said that one of the Trump health officials, and I didn't get exactly the name and everything, just came out and said that if you are not vaccinated, you will get the Delta variant before this is over. And you will face a virus like you have never faced before. And it will be tough. Now, I don't know if that guy is a kook or what he may be, or her. I don't know. But I know this, that every single additional person that we get vaccinated is absolutely another blocker that we have to stop this. Now, again, not infringing upon anybody's rights, not being an alarmist in any way, but my heavens to Betsy, that's a Trump official, health official, I think, that just came out with something that was scare the bejeemies off of me. That's just all there is to it. And so Paul, I absolutely believe in my heart, if you want me to do what I think is the very best for the people of West Virginia and be the very best governor that I can possibly be and not be a politician that caters to this group or that group, and really and truly is a person that really doesn't care much if you're a Republican or a Democrat or an independent, that governor, which is me, would tell you that we have got to be concerned, and we have got to continue the effort to try to get more and more folks vaccinated. Absolutely, this thing has not gone away. I am not being an alarmist. We're a lot better off today than we could have ever been if we didn't have our people vaccinated to the level that we have them. But Paul, it's something to worry about, and when we don't, you know, shame on us. That's all there is to it. We have already been through and seen what this thing will do. You know, my dad used to say over and over, son, it's okay to be working real hard and get the dozer hung up in the mud hole, but for God's sakes, a living son, don't ever go get the second dozer and get them both hung up. Now, and what he meant by that, you go get the second dozer, you're trying to pull one out and you get them both hung up. We know what this thing was like. We do know the vaccines are effective. We got to keep trying to get more and more folks vaccinated. That's all there is to it.
All right, thank you, Paul. Next to Kenny Bass with WCHS and Fox 11.
Hi, thank you very much. I have a couple of quick questions, if I may. The first one's for the governor. Governor Brad McElhaney in Metro News reporting that a bank is now looking to reclaim some loans that were made out to corporations that you're affiliated with personally from you and your wife. If you could comment on the latest development in this case, and also for Dr. Marsh, with all of the recommendations for small children to wear masks. What's the best practical advice you can give parents for dealing with very small children who want to take masks off and not be very good at keeping them on? What realistically, what is the possibility that small children are going to keep masks on the majority of time? Thank you, gentlemen.
Kenny, thank you. And let me just say this, and I'll be short and sweet and absolutely anything but evasive. You know, you elected a governor that had lots and lots and lots of businesses and was doing lots of stuff. You elected a guy that continued to take his wealth and to put it into trying to create more and more and more jobs, and didn't have an interest whatsoever in just sitting on his money and doing nothing. Absolutely, at the end of the day, if people will just be still and just wait for the final outcomes, you'll see a situation that will absolutely be the outcome of what your governor has already told you and everything. As far as my personal stuff and everything, or my family's personal stuff, you know, just sit back and wait to the final outcomes. You know, you can listen to all the rhetoric and really it may very well be that someone wants to take a piece of what's going on and ignore the whole. The whole is we issued a lawsuit against this bank for $420 $21 million. You know, the piece of what we're referring to here is next to nothing compared to the whole. And at the end of the day, and we just love to report the bad. You know, at the end of the day, what we need to do is just stand down and see where this thing finally wraps up, and know that my effort is wholeheartedly behind running this state as your governor and doing the right things for this state as your governor. I've got my kids, I've got lawyers, and I've got a group of people that's handling all this stuff, and I'm being your governor, and that's what I'm going to continue to do. And at the end of the day, the truth will come out, and when all the truth comes out and everything, just like it did in this investigation that cost millions of dollars that we went through for a year and a half, and at the end of the day, when we all rolled everything back, everybody walked away and said, we have looked under every sheet, we have looked under every rock, and the governor's stuff, we can't find anything. We can't find anything. That cost us a lot of money. And it cost us a lot of anxious moments and everything else as a family. But we can't find anything. There's nothing there to find. And so at the end of the day, I think from the standpoint of what I can tell you, I just say, just sit back and wait and watch, and you see where we end up. And Dr. Marsh, maybe if you could answer the other question about the kids and the mask.
Sure. Thank you, Governor, and thank you, Kenny. And by the way, just to clarify what the governor wrote down, I was referring to Dr. Scott Gottlieb, who was the Food and Drug Administrator chief during the Trump administration from 2017 to 2019. And he's widely seen as a real expert and a great person with insight into the COVID pandemic. Kenny, when it comes to the mask wearing, what we would recommend is that many children, can be taught and supported to wear a mask pretty comfortably. Now, depending on, how the child is and how the child's predisposed, et cetera, it may be harder for other children, but we would recommend very strongly that parents look at unvaccinated children as they would have looked at themselves during the COVID pandemic at a time before we had vaccines available, and take the appropriate precautions with their unvaccinated children as much as they possibly can related to the mitigation measures that we talked about early in the pandemic that are effective in reducing spread. And they include mask wearing as a really principal mitigation measure, but also physical distancing, washing of hands, covering coughs, not going out if you're sick. And if you're in mixed groups of people, particularly if people are sick, then there should be a lot of thought into that support, whether or not those children that are sick should be able to be in that environment. And most importantly, right now, it is so important for parents and people that are within the environments of those children to be fully vaccinated, because we protect our children by being fully vaccinated ourselves. And so the most important mitigation strategy that a parent can take is vaccinating themselves and the family members that surround these children all the time. Thank you.
All right, thank you, Kenny. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Great news that West Virginia has not recorded a COVID death over the last few days. That's really great. Feel good for West Virginians. Governor, I do want to pivot to a question about your role as a prominent business person in the state, following up a bit on Kenny. Carter Bank has not just sued, but has taken financial agreements that you signed to court now to claim $58 million. Can you elaborate on what your response will be? And are you saying, based on your prior answer, that the Justice Company's federal lawsuit can somehow hold off that claim or counteract it in some way? Thank you.
Well, Brad, I really, and again, I don't want to dodge anything. I want to just, tell everybody everything. But, from the standpoint of where we are with lawyers and everything else, I would breach a lot of their efforts and everything. And I really don't think I ought to go any deeper other than to just say just this. And that is, we wouldn't have brought suit against that bank if their behavior had been exactly that or close to that of the founder of that bank. Remember Worth Carter. Worth Carter, we were the primary customer of that bank for 20 years. And Worth Carter was a great friend and a great man and got sterling examinations and had earnings at that bank that were off the chart. Really did a terrific job. Now, in all of that, we never missed a payment. Absolutely, Worth and I were great friends. And in fact, the family had me do the eulogy at Liberty University for that man when he died. And then everything took an about face beyond belief, beyond total belief. And since that time, it's been a very, very, very difficult situation, of which, without any question, where we are today, Worth Carter is rolling around in his grave in many, many, many negative ways towards not us, but just towards the people that are at the bank that he built and left. Now, with all that, all I would say, Brad, is just this. It's easy to hit at the governor or whatever and come out and say, well, look what somebody said, or look what the Carter Bank has filed, or whatever it may be. All I say is just sit back and watch and wait until absolutely the final outcome. And if truth prevails, if total truth prevails, you will see a very positive outcome to the Carter Bank saga. And absolutely, the Green Seal situation, you will see a very positive outcome. The reality is really simple. The people of West Virginia elected a business guy that wasn't the same old politician that just sat watching them and keeping them in a rut. And absolutely, our state has really taken off, and nobody can deny that. And absolutely, this business guy has sat here and tried to lead you through this pandemic as best we possibly could, and the outcomes have been pretty dadgum good. So at the end of the day, that business guy had a lot of business stuff that he left to his children, and he left to all the people that were running it to do a very great job and everything. And so I would, instead of just jumping and loving to hit at the governor, which is a shame, to tell you the truth, but instead of doing that, I just sit back and wait for the final stuff to come out. And like I said, if truth prevails, it'll be a terrific outcome. And if bad stuff prevails, it could be very, very difficult on our family. But if truth prevails, the outcome's going to be really good. And I think you'll even see, I hope you'll see tomorrow, a situation with the Credit Suisse people and and the Green Seal thing, that situation is moving in a really positive way. So that should have come out today, but I think it's probably going to come out tomorrow.
All right, thanks, Brad. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I want to go back to Mark's initial question about masks in schools. When he was answering that question, Dr. Marsh mentioned both Superintendent Birch and the individual school boards. So I was wondering, Governor, if you could talk a little bit about how that decision will be made, who all is sitting at the table making that decision, and when will parents know? You know, we're about a month till school goes back. When will we have sort of a definitive decision from both the state and the individual county?
Well, Charles, let me just tell you from my standpoint, okay? First of all, you'll have all the education community weighing in, all the medical community weighing in. You'll have all that going on in every way. Big thing that'll happen between now and then is you'll have a lot of more information. As we get closer and closer, you'll have more and more and more information. But all the folks at DHHR and the education community and all the medical teams and everything, all those people will be weighing in. Now, my feelings are this way. You know, things would have to change dramatically for me to support, and not to say that we always aren't on guard and we aren't always going to pivot, but things would have to change off the chart for me to support something, you know, that would require masks for our kids, you know, at where we are today. And so, you know, we'll see as we get closer, but where I'm at, I could no way today support a statewide mandate for our kids. I just couldn't do it, not today, because I'm not there from the standpoint of concern and everything, but we will always keep everything on the table, will we not? We got to.
All right, thanks, Charles. Next to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here, and my question's for Dr. Marsh, and it's more along the issue with children and COVID, particularly the Delta variant. I was curious if you could talk a little bit more about the evidence you're seeing that children are potentially more at risk for this. From what I understand, obviously the Delta variant is more contagious, obviously, but it's not more deadly from everything I keep seeing and keep reading in the medical stuff. And I was kind of looking at the American Academy of Pediatrics data, still showing that children, particularly when it comes to hospitalizations and mortality, it's pretty rare for children to get some serious complications from COVID as it stands now. So I was wondering if you could elaborate a little bit more on those potential risks. Thank you.
Dr. Marsh, please.
Thank you, Governor, and thank you, Stephen. The Delta variant, as we've talked about, is really a new disease for us to deal with in some ways. And as you correctly point out, the people that are the most susceptible to dying or being hospitalized or developing very severe illness with COVID-19 that has been consistent throughout the pandemic, which would include with the Delta variant, are people that are older, people that have comorbid disease, have other medical illnesses, particularly obesity appears to be the most important one. But those are the people that are at the highest risk with everything being equal. But as the governor has said, and as we have very proudly been able to report, that we have seen a great uptake in vaccinations among our elders, particularly among people over 65 years old. And remember, we had seen over 77% of our deaths early in the pandemic in people that were over 70 years old. And we saw over 97% of our deaths in people that were over 50 years old. So the fact that we have gotten a lot of uptake of the vaccine and a very high percent of those people are vaccinated relatively protects them and certainly protects them from serious illness and death. but also reduces the risk, that we'll see as many deaths and perhaps hospitalizations as we would see early in the pandemic. The challenge, though, is, as Dr. Gottlieb said, that we now have a group of unvaccinated West Virginians, including younger West Virginians. Right now, the vaccine is only recommended for Americans or West Virginians 12 and older. And so we have a group of people that are not currently vaccinated, both those that are not eligible, but also we have seen a slower uptake in vaccines in younger West Virginians from those 18 and over. And we know that around the country, this virus, as opposed to the initial virus with the pandemic, which had a much lower infection rate in children, particularly children under 10 and under 15, this virus, this form of COVID-19, the Delta variant, does not seem to have that same respect for age. And so we know that children can become infected just like adults can. But because these children are healthier and because of the way this virus works, they are less likely to die or to be hospitalized or to be admitted to the ICUs than older adults, older West Virginians. But we are seeing a group of children and young adults that are now getting sick enough to be seen in hospitals, in ICUs. In, I think, Arkansas, they had 7 children in their ICU with COVID, and the majority of them on ventilators. So we know even though the numbers won't be as great, the deaths certainly won't be as great, and the hospitalizations won't be as great as if we were seeing this in unvaccinated 50, 60, 70, 80-year-olds. We know that this virus can infect children, can help make children very severely ill, go to the hospital, go to the ICU, and the concern is we will start to see more children die than we did before with the pandemic, not in high numbers perhaps, but still the risk of that is severe, and the concern about long COVID, about long-term manifestations of COVID-19. So for all those reasons, we are really, really being careful, and you're seeing a lot of these recommendations reflect the concern about the much higher infectivity rates and the severity of this virus, the Delta variant, in unvaccinated Americans and West Virginians, irrespective of age.
All right, thanks, Steve. Next to Jasmine Aduse with WDTV.
Hey, good afternoon, guys. This is Jasmine Aduse from WDTV News in Bridgeport. Just in context with the Morgantown pharmaceutical plant, Delegate Fleischauer wrote a letter modeled after Representative Diana Harshbarger of Tennessee, asking for federal help to save the Morgantown pharmaceutical facility, and sent it to you, Governor Justice, and sent it to other elected officials as well. Just wanted to get your thoughts on it. What do you think of this effort? Thank you.
Well, Jasmine, we've received it. We've got it over to Commerce. Commerce is looking at it. Everybody's reviewing it and everything. But Jasmine, look, we have reached out to the federal government. We've reached out and reached out and reached out. And believe me, if anything we can possibly support and do from the standpoint of saving those jobs and saving those folks up there, we want to do. That's just all there is to it. And we'll continue to do that, and we'll continue to work it in every way until we get a good resolution. But when somebody just walks out of West Virginia, and it's well in excess really of 2,000 jobs. But initially it was announced 1,500, but it's really in excess of 2,000. And when they just walk away, believe me, it's a difficult riddle to solve, and a lot of people are still trying. We're not going to give up, but we haven't been able to solve it yet.
All right, thanks, Jasmine. Next to David Beard with the Dominion Post.
Hi, I've got a bit of a preface to my question, but I'll get there. I was looking at the active case numbers, and they've gone up steadily since July 9th. And while the Delta variant is just at 22, we expect that to climb. When we weigh the individual liberty versus public safety, we often kind of rule in favor of public safety, and just seatbelts and helmets are just two examples. And just recently, a federal judge ruled that Indiana University's vaccine mandate is legal. I don't know how we would do it here in West Virginia, whether it would be a governor's order or a bill to put before the legislature for a special session this summer, or if the individual presidents could just do it. But should, as we're getting ready for higher ed to kick in, should we seriously be considering a vaccine mandate for higher education here in West Virginia? Thanks.
David, let me try to answer it, because ultimately it's going to come back to me anyway in a lot of ways. But you make a compelling argument from the standpoint of public safety versus individual rights, and I really believe that for the most part, folks understand that. Now, there are some folks that are so dug in, to the fact that, that they're not going to get a vaccine no matter what, and I want to completely be totally respectful to them always. But David, all I would say is, as of this moment in time, right now, I don't see any reason to move forward. I think that this is, or change course from where we are. I think we've made phenomenal progress, and it is an individual choice at this point in time. But David, I would just say this, that at the end of the day, it's so much easier for us to just get vaccinated than trying to listen to rules and laws that come down from DC. But I really think we've all got to be aware of the fact that if this thing turns really nasty, and it could, you know, it may be too late, no matter what comes down from D.C. to save a bunch of West Virginian lives. And we can surely save them today if we'll just go ahead and get vaccinated, and people will understand. You know, I've heard everything from in the vaccine. There's these tracers that are going to watch and can see where you are and everything that the government has in these vaccines. And heaven to Betsy, I mean, you know, for God's sake, to live in you, we're carrying around a cell phone. They could listen to us all day long. You know, I mean, we have a driver's license. I mean, they know where we are anyway, and so I just don't really understand it. But all I can say is today, no need to do anything in my book. You know, it's still, you know, an individual choice, and we just want to hope and pray that this thing doesn't whip around on us. And we have a bunch of folks die. That's the most important thing. Not, you know, can we mandate a vaccine or not? You know, we just don't want a bunch of folks, more folks to die.
All right, thanks, David. Next to Brendan Tierney with WSAZ.
Good afternoon, Governor and panel. My question today is a follow-up on the COVID-19 guidelines for schools that are going to be reopening in a couple of weeks here across the state. First of all, Governor, you had mentioned that you're not looking at a wide mandate when it comes to masks. Does that mean it will be a county by county? Decision for the most part when it comes to if these schools are requiring masks or not? And do you think the state will have different guidance for different levels? Say high school and middle school where more students can be vaccinated versus elementary schools where most of those students are below the age to be able to get a vaccine?
I think, Brendan, all that you're saying is going to, you know, go into the decision-making model, and you know, and we do have a lot of local control and everything, and we. respect that, but Brendan, the net of the whole thing is today. I think this discussion is way too premature. At this point in time, I have heard no one that has come to me and said, it looks like in Jefferson County or Mercer County or whatever, we're going to move to do masks on our elementary kids, or we're going to do a mask on all of our kids. I've had no one come to me. With any discussion about that, I think it's way too premature. If we were going back to school today, I don't think we'll have masks on any kids in any of our schools at any level today.
All right, thanks, Brendan. Governor, I'll turn it back to you.
Did we get everybody? Okay. We wanted to get through. I went through my stuff as quickly as I possibly could, because I think we had 12 people on the line at one point in time, and I wanted to make sure that we gave, we got to everybody and got to their questions and everything today. Nevertheless, I only made a couple notes as I went down, and the first note was, Dr. Marsh blew me away when he said that Trump official said, and I do not think this at all. I underline, I do not think this at all, but because it's just too radical a thought and everything to think that everybody that's not been vaccinated is going to end up with this Delta variant. But that's That's a gentleman that's far smarter than I on anything to do with, you know, the medical community. And so I would just always take heed. Take heed to people that are out there in the wilderness and the voices that are speaking out to us, and learn from them and everything else. But you know, if you haven't been vaccinated, I would really take heed, and I would listen to these folks, and especially, you know, if you just haven't been vaccinated because it's an inconvenience. You know, if you just, you know, if you really believe in your heart that this is my right, I don't want to do it, or I'm really scared to do it, or whatever the situation may be, that's one thing. But if it's just going to take a few minutes out of your day, and it's just more of an inconvenience, you're really supportive but it's just more of an inconvenience, but you just haven't been vaccinated yet, I mean, come on. Come on. You gotta listen. You gotta listen to these folks. And so from that standpoint, I'd end by just saying one thing. Everybody in West Virginia, please, please, please remember this day, July the 20th, 2021. We've been so long. We've lost 2,919 people in West Virginia, 2,919 great West Virginians. Today, since last Friday, is the first day in I don't know how long that we've had no deaths to report. It's a big day in West Virginia. So congratulations, and let's just repeat this over and over and over. Nothing to tickle me more. God bless each and every one of you. Thank you so much.